Good morning, Mr. Nicholson. My name is Brian. I'm the cardiac monitor technician here. We're having a little trouble producing a rhythm with your heart monitor box, and I think it might be the electrode placement. Do you mind if I take just a few minutes to just reconnect you and make sure everything is on properly?
Of course, no problem.
Thank you. All right, I see that you have your telemetry box here. Just want to take a look and see the proper placement of it. How was your morning today?
Doing okay.
Good.
Threw my Tele box off.
Yeah, I see that. Well, don't worry. We're gonna make sure you're on properly and make sure you're running for the telemetry tech, so they see a good rhythm for the doctors and the nurses to take care of you.
It is important that each colored cord go to a specific area of the body in order to produce a correct heart rhythm. The 5 telemetry cords are typically divided into 4 quadrants with an extra cord in the middle. The cords which go in the 4 quadrants are considered the limb leads and should be placed as close to the arms and legs as possible. The upper 2 quadrants consist of the white and black cords, and the lower 2 quadrants consist of the Christmas colored cords or the red and green ones. It may be a bit confusing knowing where to place each color, or you may be in a rush and may simply forget to place the correct cord in its proper quadrant. The easiest way to remember is to start with the white cord and place it in the patient's right upper side. Remember, white on the patient's right. Place an electrode for the white cord underneath the patient's right-sided clavicle as close to the right shoulder as possible, and as far away from any ports or lines that the patient may have. Placing any electrodes on an incision, bone, IV site, port, implant, or any wound will affect the rhythm. Next, place an electrode for the black colored cord in the upper left quadrant directly opposite to the white, underneath the patient's left clavicle near the left shoulder. The white and black colored cords both belong in the upper 2 quadrants. The Christmas colored cords belong in the lower 2 quadrants and are your ground leads, which means that without proper establishment, you will not produce a rhythm, even if the other 3 cords may be connected. Place the green colored cord on the patient's right-sided lower quadrant as close to the pelvic and hip region as possible. If it helps, remember the saying, the grass is underneath the clouds, so green always goes underneath the white on the patient's right side. The last colored quadrant cord is the red cord, which goes in the patient's left lower pelvic hip region. As before, try to remember the saying, the fire is underneath the smoke, so red always goes underneath the black. The cord designated for the middle is the brown colored, and is usually placed to the right side of the sternum around the 4th intercostal space. Make sure it sits within this area and not on any mammary tissue or breast. Each cord end are also labeled for your convenience to show you the areas where they belong. RL stands for right leg, RA is right arm, and LL and LA are left leg, left arm, respectively. After choosing an area to place the electrode, make sure that it is free of any dirt or oil that may be on the patient's skin by cleaning the designated spot with an alcohol pad, allowing it to dry for a few seconds, and then placing the electrode on. This will ensure that the best connectivity is made and that the electrodes do not become loose or fall off. You may need to shave off any hair that may interfere with the electrodes as well. Give a tug on the cord once placed to the electrode to make sure proper connection is made. Once all the cords have been placed onto the patient, you can double check your connection by pushing and holding the blue button down on the box for a few seconds until the screen lights up. No colored circles should be present on the left side of the screen. This indicates that all the cords are on correctly and you should be able to see a rhythm. If one or more of the cords are not properly connected to the electrode, that particular colored circle will appear on the bottom left of the screen, representing the color of the cord that is off. This tool can be beneficial when performing lead checks on a patient, directly fixing that color that's off instead of having to check all of the cords. There are instances where you may have properly placed all the cords onto the patient. However, upon reviewing the telebox screen, you still see the colored circles, indicating no connection has been made. If such a case, double check the connection of the telemetry box where it meets the cords to see if there is a tiny gap between the two. When reviewing the display on the box, it'll say lead set unplugged. To fix this issue, tightly secure the cords with the box until a rhythm is produced again. You should see the circles disappear and then see a rhythm appear. In some cases, you may have to bend and twist the cords where they meet the box for a rhythm to be produced. Another issue with obtaining a rhythm occurs when debris are within the cords. To fix this, remove the cord from the telebox, wipe the inside of the cord with a dry glove or alcohol pad, then reconnect. While disconnected from the box, inspect the inside of the cord to make sure that the gray rubber gasket is secured and not protruding out in any way. If you see that happen, remove it and then reconnect the cords. Inspect the copper prongs on the top of the telebox to make sure it is free of any debris or dirt, wiping clean with an alcohol prep pad and not Cavicide or Dispatch. Once everything is properly cleaned, you'll see the colored circles disappear and a rhythm produced on the telebox screen. Holding the blue button down on the telebox for a few seconds will allow the screen to appear in order to check the battery level, located on the bottom right corner of the screen. If the levels are 2 bars or below, you should probably consider changing the box's current batteries out because it may not last very much longer. Battery level checks can easily be performed this way during patient vital sign checks, baths, or medication passes to ensure the boxes are properly functioning.
All right, Mr. Nicholson, you look good. The rhythm is fine. Everything is properly established. I hope you feel better soon and get well. And if you need anything, just let us know.
All right, thank you.
Have a good day.